This is my presentation on hemorrhaging and blood thinners. Hemorrhaging is just bleeding that occurs due to damaged blood vessels and can occur due to external trauma such as cuts or trauma that affects internal organs such as hypertension or tumors. Hemorrhaging can occur all over the body, such as in the brain, and there are two types of main brain hemorrhages: subarachnoid hemorrhages, which means blood vessels are damaged outside of the brain and blood leaks in, or intracerebral hemorrhages, where blood vessels in the brain are bleeding. And these are usually caused by hypertension, which weakens the blood vessels over time, brain tumors, or even extreme blows to the head. Hemorrhaging can also occur in the lungs, which is called a hemothorax, and basically blood fills up in the pleural space of the lungs, which affects lung expansion and how breathing occurs, and this is usually caused by trauma such as car accidents, or can even happen randomly. Hemorrhages can also happen all around the body and range in severity. It can go from burst blood vessels in the eyes to blood in the peritoneum. Now, moving on to blood thinners, there are two main types: antiplatelets such as aspirin and anticoagulants such as warfarin and heparin. So antiplatelets are in the name. They prevent platelets from forming together, which prevents clots from forming in the body, and are normally used in patients with coronary artery disease or those who have a high risk of stroke. And anticoagulants are used to slow down the clotting rate and by inhibiting the synthesis of clotting factors or by activating antithrombin. It depends on which anticoagulant is used, and is normally used to treat DVT or given to AFib patients. Now, to put it all together, we have the pathophysiology of hemorrhaging due to the use of blood thinners, and this occurs because slower clotting times due to reduced clotting rate and ability means that more rapid bleeding can occur even in less severe cases. This is because the blood thinner medications are affecting the rate and ability of clotting through different mechanisms, which allows more blood to flow before clots are formed to stop the bleeding. And these different mechanisms depend on the medication given. So for example, if we give the anticoagulant of warfarin, this medication inhibits the breakdown of vitamin K, which reduces the amount of vitamin K dependent clotting factors, so that clotting is not able to occur. Or if we give heparin, which is also an anticoagulant, this medication inhibits different clotting factors, but it also binds to something called antithrombin, which basically stops prothrombin from turning into thrombin, which is an active part of the clotting process. But if we give an antiplatelet such as aspirin, this medication inhibits the cyclooxygenase pathways, which inhibits a hormone called thromboxane A2, and this hormone normally increases vasoconstriction and platelet aggregation in the blood vessels. So depending on which medication is given, different pathways in the clotting factors or the clotting time is affected, but the overall result is the same, in which that clotting is slowed down so that if bleeding occurs, whether it's because of an external trauma such as a cut or an internal trauma or something that affects organs internally, clotting time is slowed down, which means bleeding time is quicker, so that patients on these medications are at much higher risk for hemorrhaging because their body cannot produce clots to stop the bleeding quick enough.